I've never spoken before this group before, but I thought I would just tell you how I got chosen. They decided to bring the smartest lawyer in the country to speak on this topic, and they got turned down. And so then they thought, and they decided they would bring the funniest lawyer in the country to speak, and they got turned down again. And finally they decided they would ask the best-looking lawyer in the country to speak, and I decided after I turned him down twice already, I couldn't turn him down a third time. So today I don't know if I can get the clicker. So good at all this. Today we're going to try to talk about a number of things that could take a whole day, but we're going to try to do it in about a half an hour. But sort of a brief overview of the history of testosterone, testosterone today, the FDA, state boards, testing, informed consents, and things like that. But first of all, I wanted to let you know who I am. My name is Al Augustin, and I know a lot of doctors are not necessarily comfortable around lawyers, but I've spent the last 35 years of my life defending doctors before medical malpractice cases, in fights with insurance companies, with the federal government, and primarily with state medical boards, which is what I do in Illinois and New Jersey and New York, but all over the country. We've made this a specialty area, and in fact, one of the early doctors that I represented many years ago, you gave an award in his honor, Dr. Alan Mintz. When he was a radiologist outside of Chicago, he was one of my clients, and we became friends at that time many, many years ago. I really tend to represent individuals and small groups rather than big corporations, and that's where I feel most comfortable, although I have a couple of big companies I work with, like cancer treatment centers, but that's unusual for me. When I was looking at this whole issue of testosterone, it was amazing to me to do a little brief history over the last 10 years of the prescribing and use of testosterone in the country. In 2002, there were $324 million in sales. In 2013, 11 years later, there were $2.4 billion in sales. We're estimating that the number of prescriptions have gone over 10 times from 2000 to 2011, and just from 2007 to 2013, and in 6 years, the sales have gone from 2.9 million, not the sales, but the number of prescriptions, from 2.9 million prescriptions to 7.5 million prescriptions. In other words, what is very clear is that there are a lot of doctors who are prescribing testosterone, and there are a lot of patients who want testosterone. Now, that's absolutely clear. Now, the question is going to be, as we go forward, is the government going to get involved and try to restrict that? What do you have to worry about? What don't you have to worry about? What I'm going to try to do is give you some hints on how to try to stay out of trouble if you're involved in that world. We know there's increasing demand of testosterone. We know that the drug companies are marketing like crazy. According to Time magazine, I have on a slide here that there's $152 million spent in 2013 in advertising for testosterone alone, which is a 2,800% increase from 4 years before. 2,800% increase in advertising dollars. And obviously there you see all these ads of low T and et cetera, and and get your stamina, your sex drive, all those things back and better. We know that that's going on, so that's what the public is looking at. But we know that testosterone is a controlled drug, and we know that the FDA has approved it for medical conditions associated with a deficiency or absence of endogenous testosterone, primary or secondary hypogonadism. And we know that it's approved in a number of different ways. So that's what the FDA has done. Now, the way the law works in the country, and I assume you've heard this before, once a drug has been approved by the FDA, off-label use in the discretion of the doctor and with the approval of the patient is legal in our country. The FDA has a number of times tried to challenge that from a legal standpoint, and every time they've gone to court, they've lost that challenge. So the courts have said absolutely that as long as the drug is legal in the economy, that a doctor can use it in his or her discretion. And that's, I think, what's happening a lot in this area of testosterone right now. And it's estimated, in fact, that of the prescriptions that doctors write, about 50% of them are written off-label. Everything from a certain chemotherapy drug is approved for this specific use, and then another oncologist will find, boy, it works great with this other cancer. No problem with that at all, and it's legal. When you do that in certain areas, people get all upset. There's any of you who know anything about chelation therapy know that chelation is approved to remove lead from the body, but a lot of doctors believe it does a lot of other things good for the body, and they use chelation in the treatment of their patients, and patients want it, and many of them report great success. So this is really not, in my opinion, an FDA issue so much, although we'll see that the FDA is concerned, and we have to watch them. In September of 17th of this year, an FDA advisory committee met, and they were very concerned on how the labeling of the testosterone medications are, and so they voted 20-1 to go and review the labeling to try to make sure the labeling better says what they think it should say. I don't know what they're going to do. They don't know what they're going to do, but they're going to be reviewing that. They also voted 20-1 to do more clinical trials because of the information and data that we know about. As we know that there were some studies that came out, or one at least that came out showing increase of heart attack, and others that have said, no, that's absolutely silly. And so the FDA advisory panel says we need to do more clinical studies to find out what's really the truth here. They also, the next day, said that AbbVie had introduced another testosterone medication that they wanted to put in the marketplace, and because of all this stuff going on, the FDA said, no, we're going to stop. Just stop. We got to make sure we have a little better view of this whole thing. So they're concerned about the increase in the prescribing. They're concerned about the doctors who are doing it more and more. So we know they're out there, and we'll just have to stay tuned to what they say in the future. But the thing that I find that did I miss one? No, I didn't. There we go. The thing I find, this is where I wanted to go, that we're going to have to be careful of as we go forward is it going to become a state medical board issue? Are the medical boards from every one of the states going to start looking at doctors and say, wait a minute, you're doing this and you're doing this? And they're certainly doing that in certain areas of practice, and are they going to do it now and some more? There's been very little activity in where boards have gone after doctors for their prescribing of testosterone in the country so far. From my studies, I've only found 2 cases, and I thought I would just briefly discuss them with you. One was a New Jersey case in 2005 where a doctor was recommending that a patient every 7 to 10 days get injections of 200 milligrams. The doctor had done no examination of the testes. The board said they should have encouraged the patient to do self-injections every 2 to 3 weeks rather than going to the doctor's office every 7 to 10 days. And the board basically said, you gave a false diagnosis of hypogonadism, and they revoked his license. Now, that's pretty serious. There were certainly other issues involved in that case. He certainly was on the radar of the medical board, not just because of the testosterone, but that became another issue. And so we know that's there.